We will now show how to apply the general purpose sling from a lying position. The Human Care General Purpose Sling is a medium back model with divided leg parts. It is available both as a single patient use model and a reusable model. Always make sure to review guidelines and recommendations to help choose the right sling appropriate for your patient. The correct orientation for the sling under the patient is with the label facing up and away from any contact with the skin, like this picture. The patient should be placed like this so that the center of the sling lines up with the patient's spine. To apply the sling, gently roll the patient onto his or her side. Place the sling on the bed beside the patient, lining up the top of the sling with the head and the bottom of the sling with the coccyx. Gently fold straps under and begin to press down on the edge of the sling and slide under the patient. Roll the patient back over onto his or her back and gently pull the edge of the sling through with the palms up and keeping the knuckles on the bed to prevent any skin shearing. Pull the leg sections through between the patient's legs. It is important that the leg support rounds the hips and is pulled out at the same length on both sides. When lifting with a 2-point or 4-point hanger bar, cross the straps. Lower the lift and attach the lifting straps onto the hanger bar. The lifting straps have different color loops to allow for adjusting the length of the straps to achieve a more upright or reclined position. Make sure to choose the loop that's most appropriate for your patient. Hold the lift away from the patient's face with one hand as you raise it above the patient's head. As you begin to lift, pause when straps tighten to check that all the lifting straps are securely attached to the hooks. Continue lifting the patient. It is recommended to always maintain one hand on patient during movement for safety. Thank you for choosing Human Care.